Hypospadias is often diagnosed at birth during a routine neonatal examination by a pediatrician. Often the pediatrician can notice that the urinary opening is not at the tip. The glans is bare, which is normally covered by foreskin. The glans may be bare and the prepuce may be incomplete. Now these signs often alert the pediatrician that there is hypospadias in the child. Sometimes the diagnosis of hypospadias can be missed during the neonatal examination, especially if the hypospadias is very distal, and in some of these cases the prepuce may actually be complete. In such cases, parents may often notice that the penis has a curvature, it's bending, or the urine is going backward, or the urine stream is not normal. If any of these things are noticed by the parents, they should go to the pediatric surgeon or the pediatric urologist and get the proper diagnosis done. An isolated hypospadias does not require any specific test for diagnosis or for treatment, though the treating surgeons or the anesthetists may want to do certain tests to check the fitness and suitability for anesthesia. If the child with hypospadias also has a suspected disorder of sex development, which may be because of a small size of penis, undescended testes, or just the way the penis looks, then in such cases the doctor may order tests like karyotype, ultrasounds, and hormonal tests to fully diagnose the clinical condition. With the advances in surgery and also better training of surgeons, hypospadias has become a very treatable condition with excellent results. We have now surgeons who are trained in the art and science of hypospadiology. We have better operation theatres, better instruments, antibiotics to prevent infections, and a whole lot of advances in anesthesia, pre-surgery evaluation and care, post-surgery evaluation and care. This all has resulted in excellent outcomes and results of hypospadias surgery. So yes, hypospadias is a very much treatable condition now. Hypospadias is a very complex anomaly. Ideally, it should be treated by only those surgeons who have the interest and the training to do these surgeries. It takes a long time to get trained to be doing these surgeries. Ideally, the people who are used to handling children, are used to handling the delicate parts of the children, and also trained in doing microsurgeries should be doing these surgeries. Pediatric urologists are the first and the foremost choice in doing these surgeries. So these people get trained in urology or pediatric surgery and then take additional training in doing pediatric urological surgeries. Similarly, pediatric surgeons, after doing their masters in surgery, they get trained in pediatric surgery, and a lot of places, specifically in India, pediatric surgeons are exposed to doing these surgeries during their training, and a lot of them develop further interest in managing these children with hypospadias. Some of the urologists in India also have a special interest in managing children and adults with hypospadias. So these three specialties, pediatric urology, and pediatric surgery, are the specialties which can actually care for these children having hypospadias. But it's very important that you do a full research on the doctor whom you're going. Fortunately, with internet, a lot of information is available about the doctors whom you're going to meet. It can be, the research can be done by just going to their website. It can be done by reading about their articles, their research paper in various journals, which will tell you how much of hypospadias work they do every year. It is a known fact that if any surgeon does more than 50 hypospadia surgeries in a year, then the results will be very good and the complication rates will be lesser. So your endeavor as a patient or a parent should be to find a doctor who has a special interest and training in doing hypospadia surgery, which is evidenced by all these factors which I just mentioned.